Okay, guys, I'm going to do kind of a quick review on the Intro to Emergency and ICU Nursing. This will be for Adult 2. You can follow along with your ATI book in Chapter 3. It should be an emergency nursing or introduction to emergency nursing. I'm just going to hit on some topics that might help you guys. So remember the word triage. That means to set priorities to see who needs to be seen first, who is at risk for immediate death. Okay. So emergent with an E means life-threatening emergencies that need to be treated immediately. Okay. Urgent needs treatment within 2 hours, and non-urgent can be delayed till later. Okay. These could also be classified as your green in the ER situation, and your urgent as yellow, and your emergent as red. Okay. For your primary survey, review of this A, B, C, D, E, airway, breathing, circulation, which also includes bleeding or controlling any bleeding. D for disability, which means neuro, so their GCS, their neurostatus, and E for exposure, okay, to look if there's anything else, burns, anything else attached to them, okay? Try to find rapid assessment findings at that point, okay? Airway always comes first, okay? If you don't think there's trauma to the neck, then you're going to do just like you learn in CPR, their head tilt, chin lift. If you do think there's a cervical spine injury or if they fell off a roof, you're going to do the jaw thrust where you just push the jaw forward to open the airway that way. So you're not moving the head, okay? You're going to look in the mouth to see if there's anything that's occluding the airway, blood, emesis, whatnot, secretions. If you have suction there, you can suction. If you don't, you do with what you have. If they're not breathing adequately, you can readjust their airway again. You can suction them, provide oxygen, or do bag valve mask oxygenation, okay? For circulation, of course, we're checking what is circulation. So do they have radial pulses? If they're a trauma and they're hemorrhaging, they're probably not going to be perfusing to the radius. They may have a brachial, they may only have a carotid. So think about that. You're only going to be perfusing your core, okay? Do they have a blood pressure? If you can't get a blood pressure, and if they don't have a radial pulse, they're probably not going to have a blood pressure, okay? At least not above 60. If you see significant bleeding, direct pressure, okay, and tourniquet, okay? Again, if you're able to, large bore IV access, so 18, 16 gauge at this time. You want to give isotonic fluids, so normal saline, lactated ringers, okay, and or blood if you're in the ER and you can order O negative blood, okay? Again, this goes into talking about shock. So in these trauma patients, it might be hemorrhagic shock, which is going to lead to hypovolemic shock, okay? So they're going to be tachycardic, hypotensive, okay? All right, remember for your GCS, AVPU, AVPU, okay? Alert or alert only to voice, alert only to pain, or unresponsive, AVPU. Okay, so if you walk into the room and they look at you, well, they're alert. Okay, if you walk in the room, they don't talk to you, but you say, hey, hey, and they wake up, they're alert to voice. Okay, if you walk in the room and you say, hey, hey, are you okay? They don't respond to you, but then you give them some tactile stimuli, or you have to do a sternal rub for them to respond, then they're alert to pain. Okay, if nothing, they're unresponsive. Okay, so remember that's your GCS, and that will help give you that scale of 15 for a normal person. Remember, a dead person has a GCS of 3. Less than 8, intubate, because they're not going to be able to control their own airway. Okay. GCS is a big thing for adult 2. Okay. For the exposure area, you're going to remove any clothing, look for hidden injuries. If one of our mass casualty scenarios, the lady had a huge abdominal wound and nobody looked under her shirt and they didn't know why she was hypotensive and unresponsive, okay? So look for those injuries, okay? If you pulled them out of a body of water or if they were drowning, then again, give them blankets to warm them up, those types of things, okay? If this was like a shooting, you could preserve any evidence if you think about it at the time. That's your first primary survey, okay? So ABCDE, primary survey, okay? If you're able to do your secondary survey, or say they're stabilized now, they're back from CAT scan and they're in the ER, and you can do your full assessment, full medical history, draw your labs, wound care again, recheck any tourniquets, all of those things, okay? Contact family members, all of that is part of that secondary survey, okay? Remember, going over temperature emergencies, this is big in Florida that we get the heat stroke, okay? So heat stroke means temperature greater than 104 and altered mental status, okay? They need lots of fluids, IV fluids, ice packs, cooling blankets, okay? For Florida, we don't usually consider hypothermia a lot. However, you do need to understand that we will do warm IV fluids if it's available, warm blankets, remove wet clothing, okay? Don't just put something warm on top of them. And then frostbite. Rewarm and warm, not hot water, okay? Don't rub or massage it if you can help it. And then the rewarming is painful because it reactivates all those nerve endings, okay? Moving on in the chapter about poisoning or overdose, okay? You guys know overdose, especially if it's narcotic, you're going to give Narcan or naloxone as a reversal agent, either nasally, IV, IM, okay? Again, if they're an overdose suspected, but they have no pulse and they're not breathing, you're going to start CPR and get AED, okay? Other things to think of opioid overdose: respiratory depression, decreased GCS, and pinpoint pupils, okay? For any other poisoning or a kid that has contact with something that could be a poisonous substance, I call poison control, identify the substance, know that there's something called activated charcoal. It literally comes in a tube, it's black. You usually put it in a cup, mix it with juice if you can, and the patient will drink it, okay? We usually do not like parents or nursing staff to initiate vomiting. That used to be an old school way of thinking, that if they ingested something, we just got to make them vomit. Well, if you vomit too much and you're already kind of confused or dazed, then you can have increased risk for aspiration. So we do not induce vomiting. We don't want the parents to gag the kids, things like that, okay? So we give activated charcoal if the patient's alert enough to drink it and if poison control recommends it, okay? And that will bind up the medication or the poisoning, whatever it may be, okay? Snake bites, monitor for swelling, okay? Do not put a tourniquet on this. That's another way of thinking, okay? Sometimes it's very tricky because sometimes if you can give it anti-venom, that's the best thing, okay? A lot of these will end up going into something like DIC, where they'll use up their clotting factors and then they can bleed out, okay? So you're gonna look at the swelling and the distal pulses, the sensation, all those P's, okay? Because if it gets too swollen, they're going to have nerve injury, damage. It would pretty much lead to compartment syndrome, okay? Anti-venom is sooner the better, okay? So if you can take a picture of the snake, if somebody killed the snake, bring it into the emergency department so they can get the anti-venom, okay? It does take a lot of vials of anti-venom. Also update their tetanus shot, okay, because this was a bite. Tetanus lives in dirt, snakes are dirty. That goes with any other animal bite as well. Clean it with soap and water. Tetanus. For animal bites and rabies, remember that if it is indicated, we will do rabies prophylaxis. They will give the vaccine portion in the muscle, then they will inject the area with immunoglobulin, okay, which will help start, if there was rabies at the site, to give it the antibodies for the body to make even more antibodies, okay? And then if it's a deep puncture wound, cat bites, 80% of cat bites get infected, so patients are usually put on prophylactic antibiotics with 24 to 48 hour rechecks, okay? Moving along in this chapter, psych, abuse, human trafficking, again, back to mental health, stay supportive, calm, reassuring, safe environment, okay? If it's a female client, they might not want a male staff member, okay? Suicide precautions if needed, okay? Call Peace River. They have Peace River advocate, okay? Preserve any evidence, okay? So you guys don't get a lot of this information in school, but that is huge when you get into, if you work in the ER setting or if you have a rape case. All of that stuff has to be put in paper bags, time, date, initials, stickers. There's usually a rape kit that you will collect evidence with. If you go to work in the ER, you may be educated on how to do these and how to collect these in the future. Okay. All right. Some brief introduction to your ACLS, okay, advanced cardiac life support. So for patients who have cardiac arrest, know your shockable rhythms, okay? VFib, pulseless VFib, it's going to be pulseless. Remember, it looks like a little wave, shockable, okay? Pulseless VTAC, okay? Looks like the triangles up and down, up and down, up and down. If it's pulseless, you can shock it, okay? It's going to eventually be pulseless, okay? We do not shock asystole, which is straight line, okay? So CPR, defibrillate, drugs of choice are epinephrine, 1 milligram IV push, and amiodarone, which is an anti-arrhythmic, because they're in arrhythmia, so you need an anti-arrhythmic, okay? 300 milligrams IV push, okay? Again, for if you have asystole, or if you have a rhythm that's just occasionally like this, and you have a random beat, that is called PEA, pulseless electrical activity. So whatever your monitor is showing, if you do not have a pulse with it and no cardiac movement, that rhythm is considered PEA, okay? Pulseless electrical activity. For PEA and asystole, you do not shock it, okay? There's no electrical activity causing muscular contraction, okay? You need to think about reversible causes. So that's where your H's and T's come in. Look at your book, 5 H's, 5 T's, okay? Hypovolemia, give them fluids. Hypoxia, give them oxygen. Hydrogen ion acidosis, okay? Give them bicarb, check their sugar, okay? Hypo or hyperkalemia, a little bit harder to treat these emergently, okay? And then hypothermia, warm them up, okay? They're not dead till they're warm and dead, okay? Your 5 T's, toxins, okay? Is this an overdose? Do they need Narcan? Tamponade, okay? Cardiac tamponade. Do they need a pericardial centesis? Tension pneumo, do they have breath sounds? Do they have tracheal deviation? Do they need a needle decompression? Do they need a chest tube, okay? Coronary thrombosis or pulmonary thrombosis. Did they have a STEMI? Okay, if you get ROSC, return of spontaneous circulation, get an EKG. Do they need the cath lab? Okay, are they purple from the nipples up? Okay, are they blue from the nipples up? Is this a PE? Is that something that we can fix emergently right now if they're in a code or cardiac arrest? No. So think about the H's and T's that you can fix at the bedside. Okay. Perfect. So that is a quick review. Try to keep it under 10, but I'm at 13 minutes for you guys for the introduction to emergency and critical care nursing. Okay. Hope that's helpful.